How to know if you have a dental abscess. Okay guys, let's get started. Let's start with talking about cavities, which are made up of bacteria which dissolve the tooth surface. Once they reach the center of the tooth, which is also called the pulp chamber, the tooth itself becomes infected and the nerve of the tooth dies. Then the bacteria makes its way to the tip of the root, where the actual abscess is formed. Here we have an x-ray of an abscessed tooth. The white part on top is an existing filling. Underneath, you'll see a darker shadow, and that's bacterial decay. Once the bacteria reaches the pulp chamber, it kills the nerve and infects the tooth, and eventually it makes its way down to the root tip to form the abscess. So what are the signs and symptoms? The first and almost always present symptom is going to be severe pain. The pain is described as being sharp and stabbing. A lot of patients say they woke up at night with pain. Another sign and symptom that you might find is a pimple-like lesion on the gum tissue that will be above the tooth if it's an upper tooth or below the tooth if it's a lower tooth. Sometimes the patient's face will swell up, sometimes by the jawline if it's on the lower tooth or on the cheek, or sometimes even up towards the eye if it's an upper tooth. Also, sometimes the skin around the tooth feels hot to the touch. Some even develop a fever similar to when they have a flu. Finally, many patients suffering from dental abscesses will have a bad taste in their mouth. So what are we going to do about it? Unfortunately, there is no home remedies for a dental abscess. Trust me, I love coconut oil. I'm all about CBD and all the rest of it. Okay, crystals, count me in. But they won't come close to touching the dental abscess. It's not going to work. So what you need to do is call your dentist, because you're going to need some form of dentistry, whether it ends up being a root canal or maybe even a tooth extraction. If your dentist is not available, call another one. If none are available, find an urgent care center or even go to the ER. Afterwards, what's most likely to happen is that you'll be prescribed an antibiotic. Usually the antibiotic works within 12 to 24 hours, and the pain is drastically reduced. At this point, a lot of people make a mistake by skipping the dental visit because the pain went away. That would be a big mistake because the abscess is still there. Yes, it went down a little bit because of the antibiotic, but it will come back, and it'll come back with a vengeance. So please do not skip the dental visit. In the meantime, what you can do is take ibuprofen along with Tylenol extra strength and rinse with warm salt water. A common question we get is it urgent? And the answer is pretty simple. Yes, it's very urgent. If left untreated, dental abscesses will progress and grow in size, eventually reaching our bloodstream directly, causing septicemia, or a high bacterial load in the bloodstream, which can be lethal. Here's a fact for you. You get to decide if it's fun or not. Dental abscesses used to routinely kill people before the advent of modern medicine. Would you believe that it even killed King Tut? Hey guys, thank you for watching this video. If you have any questions, please comment down below and I'll be sure to get back to you. Have a good day and stay safe.